Hello, everybody. Welcome back to another episode of the Decoding Health Podcast. I'm your host, Dennis Kamara, and I'm here today with Dr. Julius Bruch, the CEO and co-founder of Isaac Health. Isaac Health is an early-stage startup that's focused on providing patient-centered care for the evaluation and management of dementia and a wide range of other brain health conditions. Julius, thank you so much for coming on the show.
Thank you for having me.
Yes, of course. So we always like to start out our episodes the same way, asking founders how they came up with their name. So how exactly did you come up with the name for Isaac Health?
Well, that's always a great question because Isaac Health has many meanings to us. I think that the main reason is that, first of all, we wanted a name because a name makes a company relatable and sort of gives it a face in a way. So we really liked Oscar Health and similar names. But we also wanted to make sure that it is destigmatizing because obviously dementia is a condition that is very hard to talk about. And so we wanted something smart. And obviously Isaac Newton is one of the smartest brains that has lived. So that was really our initial reason why we called it Isaac Health. But then it turns out that Isaac has many other meanings. So it actually means laughter. And I think that's very fitting because we want to be a sort of a happy, supportive place that creates a great environment for people with brain health conditions. And then it also turns out that Isaac was one of the longest living people in the Bible. So again, I think that's something that resonates very well with our mission for supporting people to live as long as possible, as independently as possible.
That's incredible. I find it really fascinating how Isaac Health chose its name because it seems like it's not just a random choice, but one with multiple layers of meaning. And it's clear that you all put a lot of thought into the name. And then that you drew inspiration from different fields and emphasized themes of longevity, joy, and scientific progress. I think it really speaks to your company's mission of providing comprehensive, forward thinking care for brain health conditions like dementia. And I understand that you co founded this company with Dr. Joel Salinas. What motivated you to want to start Isaac Health in the first place?
Yeah, so for me, dementia has always been very close to my heart. And that really started from growing up, that my grandmother had a form of dementia. And it was actually an atypical form of dementia that's pretty rare. And so finding a diagnosis just took a very long time. And that meant that I experienced firsthand just how hard it is to navigate the space for family and to get to a diagnosis in the first place. And once there is a diagnosis, then to navigate the space. And that really motivated me to then go initially into medical school. I then started neurology training, did my PhD in dementia research. Then also, even when I was at McKinsey, kept seeing that there were huge care gaps in the dementia care space. And that's really what motivated me to start a company in this space. And I was very lucky to meet Joel Salinas as a great co-founder. Joel is obviously the real expert, the medical expert in this field. And has got great experience from being the clinical director for the Center of Brain Health at Massachusetts General Hospital, and co-leading the AAN Brain Health Initiative. And I think so overall that makes a great team for this otherwise very tough problem to solve.
It seems like, as you mentioned, this is such a personal issue for you, and you've gone through many different avenues in your career, from medical school to your PhD to working on the more corporate side of healthcare. And now you're founding a company in what I would say is a very challenging fundraising environment. You and your team were able to secure a $5.7 million seed round. What were some of the biggest challenges with fundraising in this environment, and how were you able to overcome them?
Yeah, indeed. I think that the environment has become a little bit more challenging for certain business models. I think for us, what worked in our favor is, I think, mainly two things. So first of all, I think as a founding team, I think it's been relatively easy for us to communicate that we are a good fit for this kind of business model and that we really do have a really deep understanding of the dynamics that are sort of make a business in this area successful. But the other thing I think that worked in our favor is that this is such a huge market. The market for dementia diagnosis and treatment is sort of at the $100 billion range. And if you include other elements like the caregiver support and sort of some of the economic issues, that then obviously it becomes a much bigger market. And there are just very few problems in healthcare and beyond, really, that have such a sort of $100 billion market. And I think that definitely, I think, convinced many of our investors as well.
You raise such an excellent point. Whether it be through their own background or through their own research, founders need to have an understanding, a very deep understanding of the market that they're trying to go after. And speaking of research, I did some in preparation for this podcast. And what I found was that there are many patients in underserved communities who struggle to get access to high quality neurological care. There's more than 20 states in the US that have been classified as dementia and neurology deserts. This gap in care can significantly impact patient outcomes, leading to delayed diagnoses, inadequate treatment, and just overall a poor quality of life. How is Isaac Health working to close that gap and connect patients in these underserved areas with the cognitive health support services that they so desperately need?
Yeah. So the numbers are really quite staggering. I mean, there is this, as you mentioned, 20 states are classified by the American Academy of Actuaries, or sorry, Society of Actuaries, as a neurology desert. There's only 370 behavioral neurologists in the country. So that's roughly 1 per million Americans. And this is the specialty that really sort of hyper specialized on supporting these patients, in addition to maybe some psychiatrists and geriatric psychiatrists also playing a role. And then the impact of that really is that most of these patients are seen and treated in primary care because the waiting times are just so long. So the average waiting time for a memory clinic assessment is in the order of 10 months in most parts of the country. And that's just simply too long for most people. And there's actually several projections that this will get only worse. So it might be up to 4 years at some point, and that's clearly too long. The impact is mainly that diagnoses get missed, that families are sort of remaining in this limbo phase where they don't really know what's going on. It also means that patients aren't really supported well, and that ultimately leads to additional hospital admissions, emergency department admissions, nursing home stays. And this, I think I've seen a number of leads to $200 billion in additional healthcare cost. And obviously, probably much more than that in additional care cost and missed revenue. So, I think it has huge implications for patients, but also for the healthcare industry.
You you hit on such a good point, right? So it seems like, patients are having to experience long wait times, and they're not getting the adequate care that they need in order to manage their brain health conditions. So I have to imagine that insurance companies are pretty eager to try and address this dilemma. What have you been seeing in terms of the payer response to managing brain health populations?
Yeah, so I think it's definitely an emerging topic, and it's becoming more and more important for payers to engage with these populations. I think we traditionally dementia has been seen as more of an overarching conditions that just complicates many other conditions such as diabetes and cardiovascular conditions. But I think increasingly the more innovative payers and healthcare organizations are seeing that if they need to tackle dementia as a specific condition, and that by doing so, they enable then the patients to manage these other chronic comorbidities much better, and that there is a lot of value to be gained by doing that. So we are working with a variety of different payers and health systems that have seen the value in this, and we're seeing more and more companies reach out to us to implement a population level dementia program. In addition, the government is also doing their part, and this has been a great tailwind for us. That, for example, CMS and Medicare have recently rolled out the guide model, and that is, I think that is also sort of made sure that the issue is much more present in the minds of payers and health systems.
I'm really happy you're shining a spotlight on brain health. It often feels like it takes a backseat to other medical conditions, so it's crucial to raise awareness. And since we're on the topic of awareness and education, I think many people have this misconception that people with dementia and other cognitive issues are going through the experience alone, but oftentimes there's a community around them that's helping to support them get through their day to day. My older brother, Edward, has Down syndrome, and I've had to be a caregiver for him throughout different points in my life. So I have to imagine that caregivers play such a critical role in the process of managing brain health. So, how does Isaac Health include caregivers in the process and support them in terms of giving them the education that they need to support their loved ones?
Yeah, caregivers are obviously absolutely critical for supporting these members. If we think about dementia as a disease continuum, usually it starts with very mild symptoms, mild cognitive impairment, moves on to mild, moderate, and severe dementia. So it's really at the moderate stage that the caregiver begins to become really critical. Obviously, they're important throughout, but that's sort of when I would say we also switch from mainly interacting with the patient to mainly interacting with the caregiver. We have a program built out to support these caregivers. We realize that we can't do it all ourselves, right? So this is usually a collaborative effort, and we're working with community organizations such as the Alzheimer's Association and Caring Kind here, and also other caregiver support organizations that we collaborate with to really make sure that the caregivers are getting the best support possible. And that usually involves things like a 24/7 support line. It involves training the caregivers, giving them the right education and tools so that they know how to best support their loved one. It involves support groups that are not just general, but also specific to different populations, such as like sandwich generation, millennial caregivers, early stage, so you name it, and then also giving them the right one-to-one support opportunities that they can really interact with someone who really knows the ins and outs of what it's like to be a caregiver, and up to maybe even therapy. So we provide psychotherapy. So it's a rich program of options that we offer.
It's clear that you're really thinking about the whole picture when it comes to patient care. It's not just about the individual receiving treatment, but also the support system that's around them. I love that you mentioned the efforts to connect with caregivers. And from what I've read, also even dispatch home care aides to patients who might not have internet access. That's huge. It's a real game changer in terms of addressing the gap in access to care and tackling those social determinants of health head on. But it also got me thinking, with all the great work you're doing to bridge that gap, what's the next step? How can we build on this foundation to make sure that absolutely no patients are left behind when it comes to their brain health? I mean, you've got the caregiver piece, the home care aid piece. Where do we go from here to keep breaking down those barriers and ensuring everyone has the support they need? I'd love to hear your thoughts on that.
Yeah, it's obviously very important. And we actually found that in one of our first partnerships that we noticed that they were very rural, and we were shocked to see that only 15% actually had internet access. And if you are a very sort of digital forward health tech company, then the question very quickly becomes, okay, how do you bridge this gap? So we work with a set of home care aides that go into the patient's home, facilitate the visits, and that's really what makes it work for everyone. And we are very loyal to the principle of that we don't ever want our mode of supplying care through telehealth to be a barrier to anyone accessing it. We want to be a solution for everyone without any barriers. And so that's so that we've mainly bridged that gap. But once these home care aides are in the home, they can obviously also do things like risk assessments. They see a lot about sort of what's going on in the home, how safe it is, how dementia friendly it is. And so that's a lot of additional input that's actually really helpful for us in delivering care.
Love that. In doing research for your company for this podcast, I actually learned something that was quite interesting. You drew a parallel between where the current state of brain health is to where oncology was 30 years ago. Could you just elaborate a little bit more on that comparison and discuss how you see the future of brain health evolving?
Yeah, I think it is a parallel I like to draw because I think it makes just simply what's possible much more evident. 30 or 40 years ago, if you had many forms of cancer, there was not that much you could do. If you would go to a primary care doctor, they would usually sort of show you sympathy. There's like not that much you could do. And that's pretty much where we are with dementia. If you go with dementia to a primary care doctor these days, then they will tell you there's not that much you can do. But increasingly, there's lots of reasons for hope and there are options available. So it's really beginning with non-medication management, that there are things like cognitive rehabilitation. There's also increasingly medication available. There are some disease modifying treatments that are either sort of just approved by the FDA or in the process of getting approved very soon. And these are the early beginnings. And so the way we see things evolving is that there will be multiple different treatment options for different forms of dementia. And that this really becomes an increasingly complex but also effective way to address dementia, where we have the tools that are increasingly personalized so that there is a treatment available for many patients. And I think that's a very exciting way for things to evolve.
Period.
Yes.
Yeah. We are going to move into our rapid fire questions. So I'm going to ask you 3 questions. Feel free to respond with the first thing that comes to mind.
Mm-hmm.
So first question, what's one healthcare trend that you believe is overhyped and one healthcare trend you think is underhyped?
So overhyped. I mean, these days you would be tempted to say AI, but I don't think it is overhyped. I think that's real. I mean, truly overhyped, probably blockchain. I have yet to really see a great application for it. Underhyped. Well, I think there's a lot of need, so very little is underhyped in healthcare, but probably prevention. I think prevention is an area of health tech that very often sort of gets suppressed, and I think we need to do more there.
100%. We definitely agree with you on that. We need to do more in preventative care. Next question for you. What's one hobby or activity that helps you maintain a healthy work-life balance and recharge?
Yeah, so I mean, I live in New York City, so it never gets boring. Love obviously sort of exploring the different parts of the city and restaurants, but doing day trips with my fiance. But I also have a small boat, probably New York's smallest, tiniest boat, and that's also great fun in summer.
I can only imagine the restaurants, going on the boat. Seems like you're definitely able to recharge. Last question for you. What's the most important lesson you've learned throughout your career?
Probably the power of relationships and networking. I think, especially sort of with Isaac Health, I just noticed how important it is to, just know people in the field and to keep them warm and so sort of have your network of people around that can support you, because this is definitely not for anyone to do by themselves. Uh, and yeah, noticing that more and more.
Yes, relationships are definitely key. And this is our last question overall before I say goodbye. Your career trajectory has been quite diverse. Starting as a medical professional, you also pursued your PhD and later transitioned into the corporate world as a consultant. Now you've taken on the role as a startup founder. And there are many healthcare providers that may aspire to launch their own companies, but feel uncertain about how to navigate that path. What insights can you share with healthcare professionals who may be contemplating starting their own ventures?
Yeah, I think it's not to shy away from learning the business side of healthcare and the sort of the data aspects, and yeah, really sort of the side that you don't learn in medical school. I think that ultimately is very important. And then um, so yeah, maybe related to the networking point, really reaching out to people beyond the immediate provider space, like try and make friends and connections in payers and sort of in health system administration. I think that really gives you that global view of how the healthcare system works, and therefore also gives you a much better idea of how everything fits together and where there's opportunity for entrepreneurship. And there's clearly lots of problems that still need to be tackled.
Y'all heard that mic drop? I know y'all just heard that mic drop. Julius, thank you so much for coming on the Decoding Health podcast.
Fantastic. Thank you very much for having me.
Yes. Until our next decoding session, take care.